Bismillah ar-Rahman ar-Rahim. This lecture is about circulatory problem. It is of two parts. This first part is describing the circulatory problems, mainly hemorrhage, and the second part will describe about shock, which is also a circulatory problem. You have these both parts of the lecture in physiology and pathology. This is just repetition because these circulatory problems are very important in surgery. You will be faced of this in surgery a lot of times and you have to master it. Please read it carefully and go and read about it in major books so that you will master it and you will increase your view about it. Don't just listen to this lecture and be satisfied by it. Go and read about it. So circulatory problem, hemorrhage is divided in many ways. In this slide we will have external hemorrhage. External hemorrhage means revealed to the outside. That means you can see the bleeding. You can see the bleeding through the skin. There is a cut wound or there is fracture, there is bleeding through it, and you can see the hemorrhage through outside of the wound. Internal or concealed, that is hidden inside the body. You might have trauma, blunt trauma to the thorax, to the abdomen, intracranial or fracture, and you will have bleeding inside the body in these sites. You don't see the bleeding, but you know from the condition of the patient that there is bleeding inside these areas. That's why it is called internal or concealed bleeding. A second division is whether it is arterial. If it is arterial, it will be bright red because it is oxygenated, and it is spurting because there is arterial pulsation, so the bleeding will be spurting. Or it can be venous. The venous is dark because it is deoxygenated, and it is continuous because it is not spurting. It is a continuous flow. Or it is capillary. Capillary will be bright red, and it is an ooze. It's not just continuous like the venous because that is a large vessel, but these are small vessels. You will have ooze in the capillary bleeding and it is bright red. A third division of the hemorrhage, it can be primary. Primary means at the time of operation or injury. The bleeding is at the time of operation or injury. That means there is an injured vessel and the bleeding starts. Even if you cut the skin, you will have bleeding because you cut some vessels and the bleeding will start. Reactionary will start within 24 hours after the injury, whether caused by operation or by trauma. And this is caused by slip ligation. Slip ligation means that detached. If you have tied a vessel, this tie goes away and the vessel becomes free and it starts to bleed. Or a vessel stop bleeding by clot, and this clot is dislodged and the vessel starts to bleed, or other causes. C, secondary hemorrhage is during the second week after the trauma or operation, and this is usually due to infection. The area of the operation or trauma becomes infected, and this infection will lead to trauma to the tissue and it will start to bleed. Or there is sloughing of the healing process, and there is sloughing of the clot over the healing area, and this will lead to bleeding from the surface. In this slide, there is a very important part of the hemorrhage, which is estimation of the blood loss. You want to estimate the blood loss. You have this also taught to you in physiology and pathology. I will just read them and you will have them very clear. If you have trauma to the chest, it will bleed up to 2 liters inside the chest. Abdomen, you will also have up to 2 liters inside the abdomen. In the pelvic fractures, if it is a single fracture, it can be up to 2 liters. If it is multiple fracture, it can be up to 4 liters. If it is a femoral fracture, it is up to 2 liters. If there is a fracture of the arm, it is up to 1 liter. If it is fracture of the leg, it is up to 1 liter. If you have clotted blood on the floor or on the operating table or whatever, and the clot is the size of a fist, size of the hand fist. That means the closed hand, the size of a closed hand. It amount to 500 mils. If the clot is the size of a closed hand, it amount to 500 mils. If there is soiled clothes, for example, there is patient with car accident who comes and his clothes is soiled with blood, you measure the soiled area. Each 1 square foot equals 100 mil. 1 square foot of the soiled clothes is 100 mil. If he brought to the hospital by ambulance, and on the floor of the ambulance there is bleeding, each 1 square foot of the floor is 100 mil. So you want to estimate from the history, you estimate the blood, and from this area you can estimate the blood. Blood transfusion is a very important topic of the circulatory problem, and you have essentials of blood transfusion. Of course, you have taught completely blood transfusion in physiology and pathology. The essentials of blood transfusion is grouping, cross-matching, screening, proper labeling, warming, and observation of the patient. Observation to prevent or to detect any complications of blood transfusion so that you can treat the patient. Go and read about each of these